Diabetes in pregnancy is one of the other things that has disturbed mothers, a few of us, or even many others. And you could be a mother that could be going through the same thing. What is diabetes? Basically, diabetes is a condition in which there is insufficient insulin production in your body, and this actually leads to a high or elevated sugar level in your blood. What is insulin? Insulin is basically a hormone that helps to break down sugars. So whenever you eat your ugali, or you eat your sweet potatoes, or you eat anything that you eat that is carbohydrate in form, it is basically taken in and broken down by this insulin hormone. And this insulin hormone is also responsible for not only breaking it down, but also taking it to a place where it is supposed to be converted and then stored into the body. So the insulin is responsible, one, for breaking down that carbohydrate or glucose, and then that glucose is taken to the liver, and the liver now converts it into glycogen, which is stored either in the muscles or in the body cells. Now, what happens with insulin being low or insufficient is you are not actually going to realize this process, because the factor that is supposed to help you break down these sugars is not in your system, or you're not getting enough of it in your system. Usually with pregnancy, there is an increased demand of insulin. So what happens is insulin becomes highly demanded in pregnancy, and sometimes you do not have this adequate insulin, and because you are taking in these foods, the sugars will be there in your blood, but they will not be taken up by the body. So that is one of the things that tells us that you have diabetes in pregnancy. What are the signs that could tell us that you have diabetes in pregnancy? One, because the sugar is not being broken down and absorbed by the body, it stays in blood, and you get something that we call high blood sugar levels. Anything that is above 4.5 millimeters per liter of your blood of sugar, that is high. You do not want to have it at that level. So when you go for a checkup in your antenatal clinics and they tell you that you have a high blood sugar, then that means you are developing diabetes in pregnancy. It could be that you have just had a meal, but in most cases when it is confirmatory, they have to do a test where they do a fasting blood sugar level check, and then they also do, after you've eaten a meal, how much sugar are you able to retain, or how much sugar is left in your blood. The other thing that, what are the signs that would tell you that you have diabetes in pregnancy? If you're passing a lot of urine meaning you are going to the toilet almost every other time. Of course, I know you will say, when I'm pregnant, that is normal. But this time you're having huge amounts of urine. The reason as to why this is happening is because your body is trying to flush itself. It is trying to flush out the sugars. So you will have a lot of urine being passed out. Next, this urine will be having sugars in it. So this urine, when it is tested at the hospital and they do a urine test, you'll be having sugars in it. To the worst case scenario, when the diabetes is too much, you'll be also having something called ketones. Why? Because when the body doesn't get sugars being taken in by the insulin, then there is another hormone that breaks down fat instead, so that it can be able to provide energy. And when the fats are broken down, they leave ketone bodies, and these ketone bodies can be passed out in urine. So that is one of the things that you would be able to notice. Your urine is having sugar in it, it is also having ketone bodies in it, or it has one of the two. Then the other thing is you will be feeling frequently thirsty. If you're a mother that is always feeling thirsty, your thirst cannot be quenched by how much water you take. That is a sign that you could be developing diabetes in pregnancy. Weight loss is another thing that would let you know that you are having diabetes in pregnancy. This weight loss is in spite of how much food you're taking in. You have appetite, but however much you eat, you are not gaining any weight. This could be another indicator that you're having diabetes. Drowsiness or fainting. This could also be another sign that you're having diabetes in pregnancy. The reason as to why it is that way is because you do not have enough sugars that are needed for you to have energy, so you feel always drowsy and you could actually faint. Feeling constantly tired, the tiredness that cannot be taken away by sleeping or resting. That is another thing that shows you that your sugar levels, however much there is enough sugars in the blood, or there is a lot of sugars in the blood, there is not enough that is being drawn to your body cells, and therefore you will always feel like you have lack of energy because there is nothing to supply your body cells with this energy. Muscle cramps and itchy skin, especially with the hands and also the feet. The reason as to why we would have this is because sugars tend to cause a sense of numbness when they stay stagnant in a place, especially in our bodies. So this is one of the things that you would also realize. You have a lot of cramps, you have a lot of itchiness in your hands and in your feet. And when it progresses and it's not managed, then you will find that they get numb, because there is not enough oxygen that is being flowed to this side, because oxygen needs to flow there by these same cells that require energy to get to those particular places. And because they are far away from the heart only measures on the vital organs that are around it, and then these other ones will not get enough of what they need. Minor infections, you'll notice that you're having a lot of those two minor infections. You're either having boils or you're having sores that take long to heal. These are some of the things that would tell you that you're actually developing diabetes in pregnancy. Whenever somebody gets a wound when they are diabetic, it really takes them a long time to heal. The reason is because of the sugars, the elevated levels of sugars in their blood. And this is something that can develop into a very big sore if not treated. So if you realize any of these signs, please go and have yourself get checked on your sugar levels. You could be given a glucose tolerance test, where they will test how much sugar you're able to take in and how much you will be able to break down at the end of the day. They can monitor you for 2 hours every 30 minutes after taking such a test, and you'll be given medication. What could you do to prevent diabetes in pregnancy? 1, manage your diet. Please, mothers, take good caution of what you're taking in during this pregnancy. Avoid a lot of carbohydrates. Of course, I know you will say carbohydrates are the ones that give me energy, but at this time in pregnancy, protein intake is actually much better than the carbohydrate intake. If you're a person who loves taking pizza, KFC, all those things that is basically bare fat, basically carbohydrate, then you need to slow down on them, because they can actually lead to you spiking that. Change your lifestyle. Do a lot of exercises, do a lot of walks, take a lot of water, because that could also help in reducing how much sugar is in your blood. So take in a lot of water and cut down on the sugar intake that you're taking in. Take in low salt. I know you're wondering why I'm talking about salt and yet we are talking about sugars, but salt and sugars usually work hand in hand. So you're taking a low salt diet, taking low sugars if you can completely, cut them out, especially if you have been diagnosed with the same. Cut them out so that you have a healthier pregnancy. If diabetes is not treated in pregnancy, it can cause you to actually get to preeclampsia. I told you there are 3 things that usually walk hand in hand: preeclampsia, that is hypertension in pregnancy, then you have diabetes, and then you also have preeclampsia, diabetes, and those are the things that usually walk hand in hand. So you do not want to have these things occurring to you. Diabetes in pregnancy will predispose you to preeclampsia, that is hypertension in pregnancy. It can also cause your baby to retard in growth during this pregnancy, or what we call intrauterine growth retardation or growth restriction. You don't want that to happen to your baby. You can have a macrosomic baby. A macrosomic baby is a baby who becomes too fat, and that would require you to go for a cesarean section. I know some of us do not want to go for cesarean section, so you don't want to put yourself in a condition where you will have to go for a cesarean section that you would have prevented. This also can cause a condition in your body where they will be having an increased level of insulin, because they are also trying to, the blood that is going to them has a lot of sugar, so they produce a lot of insulin for them to be able to break it down, hyperinsulinism in the baby. So you don't want that condition to happen to your baby, because that baby later on in life predisposes them to having diabetes. Or you've heard of babies that have been born and then 2 years they have diabetes. That is something that you do not want to happen to your baby. So avoid all these things that we've talked about, and if you see any of these signs, please go and get checked and get help. May God protect you.